The aim of 111 is to give it a number that people can ring where they can speak to someone who can give them appropriate advice and signpost them to the most appropriate service for their needs.
Every day in Wales, the ambulance service receives about 1,300 909 calls. These range from people that will die if immediate assistance isn't got to them very quickly, through to people with really very minor health problems such as sore throats, dizzy spells, and in some cases something as simple as a small cut. What we need the public to do is think before they dial and use the right service.
There are a proportion of patients who come to the emergency department with problems that really aren't within our sphere of expertise, and some of them get told that and they don't like that, and they've waited a long time to be told that. Whereas if they access the 111 service, then hopefully they will be directed to, for example, the out-of-hours primary care service, which some people still don't know exists, and actually at weekends and on bank holidays they come to the emergency department because they think it's the only place. By accessing 111 first, they will know about the alternatives that will provide them with better care in a more timely fashion.
111 is going to be a fantastic addition to NHS Wales, as it will allow us to build on the work of NHS Direct and make sure that when people aren't sure what to do, but they know that the patient is not in an immediately life-threatening condition, they can contact somebody for advice. This advice will be from qualified nurses who will be well trained to provide the right solution. This will free up ambulances for patients that are having strokes, heart attacks, or people that are going to die if we don't get an ambulance to them very quickly. And that's what the ambulance service is for.
It tends to be that out of hours they will come to the emergency department because they know it's open, and accessing 111 would hopefully direct them to a more appropriate and more rapid source of care rather than creating big queues in emergency departments.
What we hope is we'll get fewer patients coming with conditions that ought to be treated elsewhere, which will free up some of our space and some of our medical and nursing resource to deal with the more serious conditions which are currently flocking into Morriston.